All right, in respect of everyone's time, we'll get things going. Does that sound good?
Sounds good.
So I recognize most people on the call. Do we need to do introductions? Are we okay?
Why don't we just run through introductions real quick, because we do have a couple guest presenters, and
Okay.
so
Well, I'll start it off and then I'll do the Hollywood Squares thing. Tom, introduce yourself.
hi, Tom Kuhn, PHAB coordinator for Deschutes County Public Health.
And in no particular order, me, Rob Ross, Director of Academics and Research at St. Charles, and I don't know how many years I've been on PHAB, quite a few. Caroline.
Hi, everyone. My name's Caroline Suter. I work for Deschutes County Public Health in the Suicide Prevention Program. My title is Mental Health Promotion Strategist.
Bethany.
Hi, and my name is Bethany Kushel. I work with Caroline on public health for Deschutes County, and my title is Deschutes County Suicide Prevention Project Coordinator.
Thanks. Commissioner Chang.
Hi, everyone. Deschutes County Commissioner Phil Chang, liaison to the PHAB.
Thanks. Lindsay.
Hi, Lindsay Atagi. I work with Pacific Source at Community Quality.
Thank you. Colleen or Colleen.
Hi, I'm Colleen Sinsky. When I'm not doing PHAB, I'm the Executive Director of Central Oregon FUSE, and I serve as the Vice Chair on PHAB. Thanks.
Melissa. I think you're muted.
No, I think your headset's not working.
Yeah, that's probably it. We can come back to Melissa at the end while she figures that out. Charity.
Hello, Charity Ludwig, Senior Director of Clinical Operations for Dentistry One and PHAB board member.
Thanks. Sarah.
Hi, Sarah Barron, Central Oregon Community College. I teach public health here.
Ruth.
Hey y'all, I'm Ruth. Apologies, I'm driving because I don't know how to read apparently, and I showed up to the actual physical building for this meeting. Happy to be on the Zoom call though. I am the Executive Director at Aspen Ridge Memory Care, and I am the publisher of SUS Magazine, Central Oregon's only queer publication and first.
Thank you. Amy.
Hi, I'm Amy Burrows. I'm the Administrative Assistant for Deschutes County Public Health.
Thank you, Amy. Tammy.
Hi, I'm Tammy Pike, Assistant Director of Health Services for Bend the Pine Schools.
And Melissa, did you get your headset figured out?
Hi, can you guys hear me now?
Yeah, we're good.
Great. I'm Melissa Brewster. I'm the Director of Pharmacy Services at Mosaic Community Health, and big fan of SUS. Appreciated all the music recommendations in the first edition.
Thank you.
Thanks. Did I miss anyone? I don't see anyone that I missed. Please speak up if I missed anyone. Okay, I don't think I did. So, approval of November minutes. I did read them, but if other folks read them, could we get a motion and a second? And
this is Ruth. I motion to approve.
Thank you. And a seconder.
Lindsay Atagi, I'll second.
Thank you. Any additions or changes? Otherwise, I'll assume that everyone consents to the meeting minutes. All right.
And I just want to note the October minutes are still coming. we didn't have a note taker at that meeting, so we're having to work off the recording. So it's taken a little bit longer to get that put together.
All right.
Yes. Sorry, guys, that's on me. Sorry.
You can just use Chat GPT. I'm sure it would come out with a perfect document.
No
Okay. Thanks, guys. Announcements and update. Any public announcements or new things for the FAB? All right. Tom or Colleen, I was not there in person, but thank you everyone for showing up to the retreat in person. I was just sort of a fly on the wall, but could one of you give a brief recap of the retreat?
Yeah, I can do that. And I had sent out a few weeks ago the main takeaways from the retreat that we put together and to share with everyone, because we felt it was a really productive meeting. And you know, sometimes keeping things simpler actually works a little better. And I think we really accomplished that with what we came away with this meeting. And we're going to already enact some of the things we decided for our meetings through the agenda that we have today. And that includes protective time at the end of meetings for discussion and reflection. Right now, we're calling it the FAB Strategic Dialogue Session. So you see that at the bottom. That's just a title we came up with, and open to suggestions if someone has a better idea, but that's what we were calling it for right now. We're only going to do one big presentation per month. We'll always have announcements time and time to follow up on other items that we covered at previous meetings. We will always have an ask for our presenters, how FAB can help them. And sometimes that's going to be easier, and sometimes that'll be more difficult than other times. We're going to try to get our epidemiology staff to attend somewhat regularly so they can share data, just so FAB can be on top of what the latest data is and trends that we're seeing. And then any standing agenda items will usually occur, as I said, announcements or updates, like during the legislative session, we'll have a standing item for that. And yeah, that kind of covers the main takeaways we had from the meeting, but I think we're already heading in a good direction, just trying to keep the group a little more focused. So anything anybody else wants to add? Colleen, anything, or other members?
No, I just copy pasted the email from Tom that included the retreat summaries and takeaways. I thought it was really great, especially to hear from Heather and talk about aligning FAB's efforts with public health modernization. And I just really appreciated kind of having that less agendaed space to connect and hear everybody's ideas and have some more like iterative discussion.
Absolutely. I think the general takeaway was to leave enough time to prioritize and think about the presentations and things that FAB has heard during our meeting time, and try to focus on those and do what we can, which is great. Anything else, Colleen or Tom?
Does it have to just be Colleen or Tom, or could we hear?
Or anyone else
takeaways or
can,
summaries?
absolutely. Anyone who was at the retreat or anyone else, you're welcome to comment.
Well, I don't have a voice, so but I just really appreciated also getting to know all of you better, and to really think about how we can how we kind of talked about steering the ship in one direction and looking at what's happening with modernization, what's happening with kind of the state FAB and the work that's being done there, and how we can align that with local FAB, especially when we look at a lot of the metrics that we're working on here and what we can do within public health. And I'm really excited about how FAB can help support and get the message out there of public health, because I think we have some rebuilding to do, and having those voices in the community is so important. So really understanding the programs and services that public health does provide and the directions that we're going, and some of our emerging public health issues is going to be, I think, really important as we continue to move forward. But I thought it was a really great retreat, and I'm glad I was invited. It was really fun. Thanks. And I can't speak anymore.
Well, Heather, I don't think the group knows that you about the state FAB.
Oh, yeah. So I was just asked to join state FAB. So was just appointed. They were looking, so Chloe was looking for a large county representative. I still can't believe that Deschutes is considered a large county after being here how many years, but we are. So we're in the same bucket as Multnomah, Clackamas, Washington, Lane, Jackson, Marion, and us and Benton, I think. And the Lane County Representative Jocelyn, who was the public health director, stepped down. So that seat opened up. And so I will be joining State FAB in January, really bringing kind of that local lens and our Deschutes County perspective. I think it's valuable because, you know, we are urban, but we're also rural. And I think we are very different in some ways than, you know, the Tri-County area up in Portland. And then we also have some similarities. So anything I can kind of elevate to the state level, I will be doing.
Thank you. Any other comments or input? There was a lot of good discussion there for sure.
Well, I'll just go into the next topic on there. That's something I was going to cover is I will be sending out the 2024 FAB meeting invites and schedules. I saw that there were some invites already on the calendar, which I'm not sure how those got on there, but I will be adjusting those, and I'll be sending these in a series. So if, say, you can't make one of the meetings, please still accept this series, because if you turn it down, then I have to resend it to you again a second time. And we'll still stick to our same cadence we had. We won't have a January meeting because that would occur right after New Year's. So that would just be a really bad time to try to get us together. But we'll start back up first Tuesday in February. And that will be an in-person meeting, and then we'll continue in-person, virtual, etc. So yeah, we'll definitely see everybody in person. And I'll try to, I realized with this meeting invite today, I didn't indicate specifically in the subject line Zoom. So I'll try to make sure I always, before the meetings, am very specific so people don't forget, because it can get confusing for sure. So anyways, just look for those invites to come. That's all I have.
Thanks. All right. Well, being unusually ahead of schedule, Caroline, are you ready to present?
We are.
That's awesome. Hopefully we can get a robust discussion going. So
Sounds good.
welcome you to.
Yeah, thanks for the invitation. I'm going to share my screen here. Can everyone see the PowerPoint? Great. Okay. Well, thank you to FAB and all of you for inviting our program to present today. We're just going to go over a little bit about our program and then do a kind of a quick brief highlight around a project that we're working on to give you a little bit of an idea of some of the things that we do. But first, just in case y'all didn't catch our names and our titles, but my name's Caroline Suter. My pronouns are she, her. I am the mental health promotion strategist, work in the suicide prevention program and the prevention and health promotion side of public health. And Bethany, do you want to mention yourself?
Sure. Yes, thank you. So my name is Bethany Kushel, and I use the she, her series of pronouns as well. And I work with Caroline Suter, again, in health services under public health in the suicide prevention program. So thank you all for having us.
Yeah. Okay. So the first thing that we always do as a program is talk about safety, because we do recognize that suicide can be a difficult topic. It often touches a lot of us in professional and personal ways, and we want to recognize that. We also want to model best practices around how to speak about suicide safely. And so one of the things that we do as a precautionary measure is just to set up some safety standards whenever we present, which is in a virtual setting. If anything happens to arise for you and you need any extra supports, please feel free to directly chat myself and Bethany and let us know if you need some additional supports. We want to recognize that sometimes things come up for people when we talk about this topic, and we want to be here as supports. And we're also, as we go through this presentation, we're going to talk about resources. And so you'll also have an opportunity to know what our resources are locally. Okay. So in our program, we utilize a public health approach when it comes to suicide prevention. Our work spans across prevention, intervention, and postvention. And just for some of those who may or may not know what postvention is a collaborative and comprehensive response in a community to, whenever there is a suicide death, to lower further risk, because research does show that if we have someone who passes by suicide in our lives, we may in turn have susceptibility of having some suicide related behaviors. And so postvention is really a comprehensive outreach approach to lower community risk and promote healing. But our work spans across those three buckets, utilizing a universal, selective, and indicated approach. So kind of overarching approaches, kind of more dwindled down to groups and then to individuals. And our program does respond to the whole lifespan. So our prevention efforts go across 0 to end of life. And so Bethany's going to go over some work examples here to give you kind of an idea of our public health approach when it comes to suicide prevention.
All right, so yeah, just an overview of some of our program work examples. So one thing that we always like to highlight when talking about the work that we do is that Oregon is the first state in the nation that has suicide prevention, intervention, and postvention legislation. And we work with that legislation. So Addie's Act, or Senate Bill 52, is a bill that is in place that requires all school districts to have a really comprehensive suicide prevention, intervention, and postvention plan in place. And our program does a lot to uphold that for the 3 school districts. In Deschutes County, we do a lot of work to support what's going on, including providing technical assistance, education, trainings, and all sorts of supports. And then another bill is the postvention legislation, or Senate Bill 561, which is some legislation around each county required to have a postvention response lead and responding to deaths for ages 24 and under. We want to highlight, though, that while we work with these mandates and for these mandates, they are unfunded, which always poses a little bit of creativity when trying to do our work in these systems. Some more of the program work that we do is we provide evidence-based trainings to both systems and the community. So just a brief highlight of some of the more popular ones. First is QPR, also known as Question, Persuade, Refer. And this is a introductory to suicide prevention and intervention training that teaches participants how to ask the question directly. If they think someone is thinking about suicide. So Caroline and I do QPR almost every week throughout the whole year. Our school districts have requirements that all staff are trained. This year, we started training transportation staff for the Ben Lapine School District so that we really have this wide community of gatekeepers that are able to like notice the warning signs, be aware of kind of the issue that suicide is in our community, and then be able to ask the question directly and then have a workflow in order to then refer the student on to appropriate help. We also provide these for organizations where we tailor them to organization workflows, and we also provide them to the community as well. So it's really fantastic training made for anyone who's interested in learning more and being able to intervene with someone who might be thinking about suicide. We also provide assist or applied skill or applied suicide intervention skills training. We do this training 2 to 3 times per year, and it's open to the community as well as different organizations and of course our school staff. And Assist is this amazing, really comprehensive 2-day training that goes over attitudes and beliefs associated with suicide, how to notice warning signs, how to understand other individuals' experiences, and then it talks through how to work with someone in a suicide crisis to help keep them safe for now, while also being culturally responsive and kind of managing a little bit of managing your own beliefs while going through that training. Oh, thank you, Colleen. Yeah, that's great that you took it. It's one of my favorites for sure. And then another training that we also provide is Connect Postvention. And this goes alongside the postvention legislation. So it is a training that teaches best practices to help community groups or systems respond in a suicide death using best practices in a comprehensive collaborative approach. It's a really fantastic training to kind of be proactive in setting up systems in place so that there can, again, be this really safe and response in order to lower community risk and after a suicide death. So these are some evidence-based trainings that, yeah, we offer multiple times every year. If you're interested in any of these, please reach out. And then another component that our program participates in fully is around safe messaging. When we're out in the community, when we're providing technical assistance, when we're working with the media, whatever that might look like, we're always emphasizing that safe messaging is really important because how we speak about suicide matters. When we're using suicide safe language, when we're using safe messaging, that's lowering stigma, that's increasing people's help-seeking behaviors because we're not portraying any level of judgment when we're talking about suicide in these safe ways. So there's been quite a bit of research that comes from suicide loss and suicide attempt survivors about how people wish that they were spoken to when they were in these situations. So some examples are just speaking about suicide directly and frankly as it were any other health condition. Historically, we've used the word commit to talk about suicide, and that really portrays this level of judgment as in like committing a crime or committing a sin. And we don't want to put any sort of judgment on anybody's health. So instead, we just changed that language to something like died by suicide. As we would talk about, died by cancer. And that really does lower stigma. It lets people know that we're safe and not judgmental and that we're here to talk to them. So it in return reduces isolation, shame, and then increases people's ability to seek support. And so we're always talking about safe messaging and educating on safe messaging in the community and why it is so important as such a big piece of our program as well, so that we can kind of lower a lot of that stigma that's associated with the work that we're doing. And then one more key component of our work is that Deschutes County is the backbone organization of COSPA, which is the Central Oregon Suicide Prevention Alliance. So COSPA was established in 2012 as a regional effort, and it's shared work across Crook, Jefferson, and Deschutes County. COSPA utilizes a multi-work group model to share the work and resources, and then it also is integral in supporting local community suicide prevention events and managing system projects and more. I believe Caroline will go a little bit more detail into some of the work that COSPA is doing, but again, our program is the backbone to this, and there are 3 main work groups: the leadership work group, the general membership group, and outreach group, and those all have very specific and different responsibilities and tasks in our community. Caroline, should I speak more to that, or do you cover that? I don't want to reiterate.
I don't cover it, so
Okay.
yeah.
So our leadership work group kind of has an action plan that runs and guides the work that is happening through COSPA in our 3 counties, and that's made up of people that are in leadership positions across those 3 counties in specific sectors. So there's representation from behavioral health, public health, schools, hospital systems, loss survivors,
Faith.
Faith, law enforcement, just a pretty great gambit of representation in that group. And again, they work through an action plan and drive the work that happens in the community. We also have the general membership group, which everyone and anyone is invited to, so please let us know if you're interested. And this group meets quarterly, and we gather together virtually quarterly to talk about local projects that are going on, work that's being done, as well as local data. And then we also have the outreach work group that's comprised primarily of suicide, loss, and attempt survivors. And this is a group of individuals who are working in the community to put on events. So just in the last couple months, we have put on a candlelight vigil for suicide loss survivors. We have put on an International Survivors of Suicide Loss Day event, and all of that work is supported and bolstered by this outreach group. So lots of great work done by COSPA and its members.
Okay. Now that we've done a little bit of overview of some work examples, we'll just hop into a little bit of data. And as we go through the data for Central Oregon and Deschutes County, we just want to highlight that each slide that we go through is going to have a resource listed on there. And so we really urge all the folks here to save them in your phone because we just never know when we might run into someone who might be struggling, and it's always helpful to have it quickly at hand. So this is data that we do know within our region. And one thing is that our program prior to Bethany and I had its first version of a Deschutes County suicide data trend report, and it covered previous years. We just released the second version, which covers years 2000 to 2020. I think we'll try and put a link into the chat here where you can find the whole report. It's public on our website, but this is our second version covering data trends and current efforts across these 2 decades. And some differences when comparing the first version to this current version is that we really wanted to bolster resource sharing and folks to know where people can access supports and resources and services. We wanted to convey what our community partners and our program are doing and all the programs within Deschutes County Public Health to help lower our rates, as well as provide a little bit more hopeful lens for the reader and recognizing that a variety of different populations might be reading this report. So some key findings across these 2 decades is that we saw around 638 individuals die by suicide in Deschutes County, which equated roughly to 3 people had passed by suicide per month. 2017 was our highest suicide death count. When you look at the span across the 2 decades, we averaged about 35 suicide deaths annually, with the exception of 2017. We had a 22 count higher than the previous three years and post 3 years. And we worked with our public health epidemiologists to try and dig into trying to find some correlations as to why we saw a high rate that year, but we really couldn't determine anything significant to speak to. But that particular year threw our rates off a little. And that was across all age groups. Overall, our rates are higher than the state of Oregon and the United States when looking at our data across these 2 decades. We are seeing female suicide rates are increasing, which includes deaths by firearm. Historically, that has not been a means that has been used with that population. It's been kind of lower rates, but we are seeing an increase, which does match with the nation. And then our youth, ages 10 to 24, suicide rates continue to rise gradually. The resource we want to highlight here is our Deschutes County 24-hour crisis line. Feel free to save this into your phone. It's 541-322-7500 and dialing extension 9. That is a resource for our community members if they're experiencing any mental health crisis to speak to someone over the phone to get some supports. Now, when looking at lethal means in Deschutes County, we have a higher suicide rate by firearm than both the state and the nation when we're looking across these 2 decades, seeing that about 58% of suicide deaths were by firearms. Our age group 10 to 24-year-olds, we saw 57% of suicide deaths were by firearm, and that was across the last decade. And we'll dig a little bit deeper into this in particular because this directly relates to the project that we're going to overview here in a moment. But before we do that, we want to highlight our National Suicide and Crisis Lifeline 988. This is a fantastic resource that anyone can use. They offer there are mental health professionals on the other end of the line, English and Spanish. You can call, you can text 988 any time of the day, any day of the week. You don't have to be, one thing to highlight, even though it says Suicide and Crisis Lifeline, you don't have to be in crisis to use 988. If someone is struggling with substances, if they are having a bad day, if they're in between behavioral health appointments and need some support, 988 can be utilized for a variety of different reasons. And they always highlight to never hesitate to share this resource and to utilize it, because ultimately it can help lower any escalation that might be going on for an individual. Over 90% of the phone calls and texts can be de-escalated and not require any additional supports. So it's a great resource for us to have. And then just a quick overview. That was just a very brief snapshot of our data. There's more in that report, but we want to highlight that suicide is a complex public health issue. There is not one factor as to why people struggle with suicide, and even one death by suicide is one too many. And so we want to remain vigilant, know our warning signs within our community members and the resources, and be able to help those who might be in need. And so our last resource that we want to highlight is our Deschutes County Stabilization Center that is also open 24 hours a day, 7 days a week. 7 days a week. It's free, it's confidential, mental health supports for people who might be needing some kind of in-person supports as if they're struggling with their mental health. So, recognizing some of that data that we just briefly went through, we're going to highlight a project that our program is involved in alongside our Central Oregon Suicide Prevention Alliance, or COSPA, which is a Central Oregon Secure Firearms Storage Project. In response to recognizing that our suicide rates by firearm are higher than the state and the nation, and this is the case across the whole lifespan, COSPA, our alliance, determined to work on an educational and awareness campaign regarding secure firearm storage in the Central Oregon region. So not only did that validated data that we just briefly went over and what is more in depth goes over within our report highlight, but also through our unvalidated data through our postvention response related to that legislation Bethany mentioned earlier, we are aware that a lot of homes who may have firearms in it may not have the resources to be able to securely store the firearms. And so this whole project is living so that we can have a preventative response and help lower our rates. So there's really 3 components to this project. The first part of the project was our Central Oregon Secure Firearms Storage Summit that occurred in October, and we'll talk here briefly about what that looked like. And then our 2 other components to this project is developing an English and Spanish public service announcement with a promotional campaign that would include social media, physical marketing materials, resource development, and more. And then having a website with resources and the PSA and promotional campaign materials housed there. So the summit functioned as a way to inform our public service announcement, which will then be the call to action within the public service announcement will direct the viewer or the listener to the website with all the resources. And so I'll talk a little bit more here about that. So this project lives with our Central Oregon Suicide Prevention Alliance. There is a sub-work group underneath the leadership work group called Counseling on Access to Lethal Means, or CALM. That is an evidence-based approach to reducing access to lethal means if someone were in crisis. So there is a whole sub-work group of the Alliance that's tasked with managing this project. One thing to highlight that I failed to mention is that this project is being funded by a Oregon Health Authority coalition grant. COSPA determined that they wanted to work on this and applied for a grant, which supplied $20,000 worth of funding to work on this project. So that is how they're able to fund this work. So the folks at the table at this work group, sub-work group, who is working on this project is Bend Lapine Schools, Bend Police Department, Crook County Prevention, Deschutes County Prevention, Jefferson County Prevention, and Sun River Police Department. So we held our Central Oregon, that first part of the project is the Central Oregon Secure Firearms Storage Summit. This summit was the purpose of it was to pull firearm owning community members and organizations together to increase buy-in to help support this project and be co-collaborators around helping us lower our suicide rates by firearms. But also another purpose of it was to get feedback from these community members and organizations around what's the messaging we should have, what are words and language we should and should not use, so we do not alienate people, and we want to increase behavior change for firearm owners who may not securely store to do so, and where to go to get that resources, inform what looks best, what is best for an English PSA versus a Spanish PSA. And then just diving deep into branding and resources that we should have, and just getting all the information we can possibly get from our community partners to help us have a really comprehensive result and product. So all these folks here on the slide here attended our summit, and Heather Keisner was one of our folks who was a table facilitator actually at the summit. So we had table facilitators at each table, and we tried to split all these organizations diversely across the tables to get the input. And we had a whole presentation kind of talking about the scope of the issue, going into some data a little bit, and then guiding a community conversation that spanned roughly around an hour. And then we had lunch afterwards just to kind of connect. So I would say, yeah, I think we have some explanations of some of those groups on there. Now, there were other folks who were invited who were unable to attend, but did provide their support and input, who were not there that day. And these were some of those organizations that were a part of the background coordination and facilitation of this part of the project. And this is an ongoing piece, this conversation piece that the Alliance is continuing to explore and see how we might be able to continue having the conversation with our community partners to better inform our community members and organizations to securely store. So our next steps for this project is we have synthesized all of the qualitative data from that summit. We worked with University of Oregon Suicide Prevention Research Lab to analyze that qualitative data and pull out themes. And so the Alliance ultimately synthesized that data and informed a request for proposal media campaign bid that is actively out to specific media developer organizations. And so here in about, I think, a week and a half, we're going to be reviewing those bids and determining who we might go with to develop a public service announcement in both English and Spanish. And so we'll be working on the development, production, and distribution of those campaigns, as well as all the social media and physical marketing material to promote it. Alongside that, we'll be also working on the website development. The call to action, again, within the public service announcement is to direct the viewer or the listener to the COSPA website. There will be a whole tab that is dedicated to this project, and we'll have a variety of different resources listed on there. And so that is another piece that we'll be working on, is identifying the resources and pulling that information from the summit of what we should have on the website on there. Now, some challenges to this work, and then just our overall program work, is ultimately we really did, with this particular project, wanted to create a secure storage map for firearms. We had a vision that we would create an interactive map on our website where a firearm owner could get on there and look where they could securely store their firearm. What we're learning is there is a lot of complications and issues and a lot of significant hurdles that really the way to kind of address that and lives more at the state level, because it really is around being able to release a firearm back to a firearm owner and the intricacies around that. And so ultimately there might be a little premature for us to be able to do a map right now. So we're kind of pivoting a little bit and identifying other resources that would be better suited for our community members. Of course, funding and capacity is always an issue, not only for our Alliance and our projects, but also our program. And so that is always a piece that we bump up against. And then the last bullet point, legislative ambiguity, is more around our program itself. While the legislation that we have in our state to prevent suicide has good intentions, there's a lot of gaps within the legislation around how to direct the work, the fact that it's unfunded. There's a variety of different complications associated with the mandates that creates some, stop gaps around us being able to work fluidly, to do what the work is really meant to be related to those mandates. Now, how can PHAB help our program and the project that we highlighted. So coalition recruitment for our Central Oregon Suicide Prevention Alliance. As Bethany mentioned, one key group that we have is our community outreach work group with the loss survivors and attempt survivors. And we would love some extra support, and Bethany can speak a little bit to what that would look like here in a moment. But that is one work group that we would love some more participation in. And then, of course, our general membership, as well as our leadership work groups of the Alliance. General membership, recruitment and membership is always open. And then our leadership work group has vacancies in certain sectors periodically throughout the year. And so really just connecting with Bethany and I, if there's someone who is interested that you, or someone you've spoken to that you think would be a good fit for the Alliance, just connecting them with us. Bethany, would you say anything more about the community outreach?
Yeah, just to add, as mentioned, community outreach puts on events and are really active in like from August until November. And so we are always looking for more members, whether it be to attend the events, to help promote the events, or to help plan the events. We're always looking for more members in that. And so if you're interested at all, or know anybody who might be interested, we would love to hear from them.
And then resource building. We're always looking for training spaces for some of those trainings we mentioned earlier. If you have any connections with firearm owning community organizations and members, and connecting them with us and our Alliance related to the project that we just highlighted. Or, just resources or individuals that might be helpful to our community and helping us be aware of those folks or resources, because we're always out in the community promoting resources and supports and services to help lower our rates when it comes to suicide. And then advocating. Letting our Board of County Commissioners know that you're in support of our program and advocating for increased funding. One thing to highlight is our Garrett Lee Smith grant, which is a federal mental health, behavioral health grant. It is sunsetting this fiscal year. So by July, that will not be a funding stream for us. And so a specific need would be to advocate to our Board of County Commissioners and Commissioner Jang, I recognize you're in here, but just having increased funding for our next fiscal year and those to come, because we always have to be pretty creative around our funding stream, particularly given, as we keep highlighting, legislation is not funded. And so we have to be pretty savvy with that. Also, advocating for bolstering our culturally appropriate resources and systems, bolstering such resources within your own organization in order to meet the need of our culturally diverse populations with Central Oregon is always a piece that we would love help with. And so with that, this is our contact information. Feel free to take a snapshot. We'll also put our information in our email in the chat here, but we're open for questions or anything that you'd like us to chat about.
Just a comment. I'm really pleased that you're trying to intervene in safe firearm storage. I love the reasoning that guns don't kill people, people kill people, but if you own a gun, it's much more liable to be used against yourself or your own family members than against something else. So, starting with safe storage is relatively benign, I believe.
Yeah, thank you. Firearms is one of our more lethal means across the globe when it comes to suicide, and the counseling on access to lethal means, evidence-based training talks about, that sometimes the decision to take one's life is really brief and short.
Yeah.
And the more that we can create some stop gaps for folks who might be in crisis to utilize a lethal means, the better. And working collaboratively with those who actually do own firearms can just make this more of a comprehensive approach that could reach people wider.
Yeah.
I just wanted to say first and foremost, this is incredible. Y'all's work is amazing. I'm curious if you have ever looked at doing a voluntary purchase delay database here. There's a law in Louisiana called Donna's Law. And it's a friend of mine named Katrina who she lost her mother after her mother purchased a gun and chose to take her own life. And she started Donna's Law. It's a voluntary purchase delay database in Louisiana where you can put yourself on the database list and you won't be able to purchase a firearm for a period of time. And I think they've had a lot of success with that. I don't know if that's something y'all are familiar with, but I really appreciate everything y'all are doing. This is incredible.
Oh, yeah. I haven't ever heard of that legislation. Have you, Bethany? Yeah. And it's DONNA. Donna's.
DO and Donna's Law. I can put the website in the chat.
Okay.
Yeah, that would be great. Thank
Yeah.
you.
Yeah, thank you. Commissioner Chang.
Thanks. So what the scope of the program that you were just describing, it seemed like it was very focused on self-storage, safe storage of your own guns. There is in our community and in the state of Oregon, we have access to the Extreme Risk Protection Order authority and program, and I'm wondering whether that's kind of outside the scope of what you're talking about, or whether it's pretty adjacent. So I'm wondering whether that ever comes up in discussions, about safe storage.
Yeah. So Extreme Risk Protective Orders, or ERPO, comes up a lot. Our county actually, there was recently a report that came out for the state of Oregon, and our county is actually really high as far as utilizing that precaution. There is some myths around utilizing ERPO. One is that a lot of firearm owners are concerned that a variety of different people, professionals in the community, have the ability to take their firearms away, that it's not temporary. There's a variety of different things, but there is definitely room for education around ERPO, and that is threaded throughout this project. And there is discussions around, is that part of some of the material that will be living on the website to inform community members, dispel some of those myths and provide more facts, have quick access to the forms to do so, because really ultimately it's law enforcement and family who can file an ERPO.
Right. Thank you. I'm really glad that there's, even though it's not a self-storage option, that you guys are still integrating some of that information along the way. And you're right, we have one of the highest rates among counties of use of ERPO in Deschutes County, but almost all of it is Bend PD. So there's still a lot of opportunity, in the other communities within Deschutes County and in the unincorporated county to see better use of ERPO to help people take care, protect themselves and their loved ones.
Thank you.
And do you know if ERPO is used in Jefferson and Crook as much as, I know this isn't the purview, but
The
we're
rate
kind of one big happy triad.
the rate of usage is much lower in those other counties. This is an authority, you know, it was a, I can't remember if it was state legislation or whether it was a, you know, like an executive order or something like that. But you know, communities across the state of Oregon have access to you know, petitioning for extreme risk protection orders to have someone's firearms temporarily taken away. But the uptake, the use is really variable across the state.
And Colleen, did that answer your question?
Yeah, that did. I guess I was also curious, not having seen the report, if that report made the same distinguishing data that Commissioner Chang just mentioned.
Yeah, I'm putting the report in the chat so you have access to it. You know, off the top of my head, so your question is about the neighboring counties. Am I hearing you right?
I think that was Rob's question. I was just curious if they disaggregated the data between city and county use of ERPO. But thanks for sharing that report. It doesn't look like they do based on a really quick check.
I was gonna say, Bethany, do you know more? But I feel like it was just county.
Yeah.
Yeah.
I can just volunteer that I first heard about ERPO from the local Moms Demand Action for Common Sense Gun Policy chapter, and you know, so they mentioned it, and they said, you know, we have a high rate of use, but we'd like to understand more about that, and so their prompts led me to follow up with you know, with various entities, and that's how I got that disaggregated data. You know, if it's I won't get these numbers exactly right, but you know, if there was 16 uses of ERPO in Deschutes County on a given year, you know, maybe 14 of them were within the Bend Police Department, one was from Redmond, and one was from the Deschutes County Sheriff's Office, or you know, those kinds of proportions. So it really is you know, someone you know, and someone who I spoke to along the way attributed it back to a specific officer who used to work at Bend PD, who she was just really good at identifying situations where not only it would be helpful to have someone's guns temporarily removed, but also where you know, people would be willing to, you know, family members would be supportive, and it would be a very, you know, positive experience, I guess, where, you know, there would be a lot of support within that person's community.
Thank you, Commissioner.
Sarah, you had some questions, I think.
Well, it's very interesting what Colleen put over in the chat about the training, and it really speaks to the training within the law enforcement around this. So anyway, my questions are not related to this at all. So before I change the subject, I don't want to, is it okay for me to jump? Anyone? All right.
Well, if anyone else has questions directly related to the presentation and suicide prevention, fire away.
Oh, it is. Oh no, it's totally related to the
topic.
Okay. I just want to jump off the conversation that was happening now. My two questions are related to the coalition. I heard that you're looking for members. You know, I'm working a lot with early adults and college students. Would that be just, and it's okay if you're looking for more seasoned professionals, but just curious if you're interested in having representation from that group. And you don't have to answer, just putting it out there. If you're like, yay, yes, great, then maybe I could recruit a student who's maybe a community health worker or a peer support specialist who've been through the training, or a young adult I don't know, are you looking for a certain age range or population, or that would be a more open question that would not put you on a spot?
Yeah, I think it depends on which group. So
Mhm.
general membership, anyone who's interested in suicide prevention and wants to get more information is invited. The
Mhm.
leadership position is, or the
It's
leadership
more leader. Okay.
is people
Okay.
that, yeah, can kind of guide some leadership changes within their organization. As far as the outreach group, I mean, we haven't really had a youth. I think we would want them to be over 18 to
Yeah,
that
it would be an
talk.
early
And-
adult,
But
like in
yeah,
their 20s.
it's generally loss survivors or attempt survivors that are interested in being in the community, providing outreach and working on these events for other community members. So I think that would be fantastic to have.
And then let's say presentation right now, COCC is not mandated to have, like, K-12 has the 80s law, and I understand that community colleges and colleges, do they, or is it just community colleges do not need to have a plan in place?
Public universities, not
Okay.
communities.
Yeah.
Okay.
Yeah.
So the plan that you helped us with and Ben Lepine's work, they have drafted the plan over the summer. So thank you for that. You are both of you are an amazing resource for to make that happen, and I want to thank you so much. So now COCC leadership is taking that on, and now they're going to have a student who's going to do an educational campaign on 988. All the things that you presented here, and we're going to try to raise awareness. So you're going to hear from a student again. So it's another practicum. They're going to operationalize the plan. So,
Awesome.
I just wanted to thank you, and that's it. Those are my two thoughts and questions.
Awesome. Thank you, Sarah. Yeah, we're excited. We're
Yeah.
excited to work with your students.
That was like a big deal. You started over 3 years ago. Remember that?
Yeah.
So that these are change agent people right here. Right here. They're doing systems work. So thank you.
Thanks, Sarah.
Colleen?
Yeah, thanks. Just thank you so much for the work you're doing. I think especially around postvention, which I think hasn't been a conversation for very long, or at least like I haven't been aware of it. But back when I was in high school, there was like a whole slew of deaths by suicide one year. And I think that it became more than just one, and it became like 6 in the same 2 years because there wasn't that postvention response. So I'm so glad to know that as a state and as a community, we're moving in that direction. And related, had a question about resources for really acute postvention. I used to volunteer with a group called the Trauma Intervention Program for TIPS Northwest, where we would respond on the scene of completed suicide and delivering death notification. And I don't think that exists here, but is there anything similar, or what does that look like here?
The closest thing that we have, so TIPS is kind of volunteer-based folks. A lot of them have background in like behavioral health and whatnot, that respond to a community when there's more like a traumatic event. It's not always just suicide, but like Clackamas County has a TIP program that they rely on for immediate response after a suicide death. And the closest thing that we have here is our Central Oregon Public Safety Chaplaincy. We have a whole group of chaplains who are spanning it across, really it's across Deschutes. Well, they go up to Jefferson too. So yeah, it's across Jefferson, Deschutes, and Crook, but mainly within the Deschutes County area, and that they have chaplains split across the regions. There's over 20 of them who respond, and so usually it's law enforcement leaning on identifying if that's a need, and they operate like first responders and respond to the scene. So they are part of our postvention protocol and response, and they're a system we lean on frequently when we do postvention work.
Thank you.
Yeah. Also want to highlight that another purpose of postvention is to kind of mitigate exactly kind of what you were speaking to, Colleen, where there might be a cluster or contagion effect, and trying to get ahead of that if that were potentially to be the case.
Any other questions or comments? Yeah. So one thing this reminds me of is like, these things are also incredibly interrelated, like suicide prevention, compulsive suicides, psychiatric care, behavioral health care, all of these things, and access. And it always amazes me that the state will fund certain things and then expect people to step up to the plate, thank you, for unfunded mandates that seem to be very important to them. Like if you're going to ask people to work on this, figure out how to make this a permanent funding without having to apply for grants and, you know, piecemeal support. So thanks for all your work, folks.
Thanks for inviting us.
Any other comments or questions? All right.
Commissioner Chang had a question.
On the idea of dedicated funding, maybe at the state level, I think it would be actually, this is the kind of topic that constituents talking to legislators can make things happen. So, you know, this could be a project that some PHAB members took on to talk directly to our state legislators about this program and you know, about the need for a dedicated funding source. And you know, these are the kinds of things that legislators want to solve. So it seems like a good advocacy item. You know, I can certainly I will try to get my fellow commissioners to make this a part of our legislative priority package, but the PHAB might be able to accomplish more without the Board of Commissioners than with us.
If I could just add a quick note to that, for advocacy purposes, the bit that I copy pasted from the report, the sentence right before that I didn't include said that this was an example of the training that was effective, but there's a need for like the statewide training so that it's not just an anecdotal example of success. So anyway, for anybody who's doing advocacy, there is a great little nugget there.
Yeah, very important.
I have a question off of what Commissioner Chang just said or stated. If one thing I remember in our retreat was that we are advocacy roles, and so I love this idea of advocating directly to the legislation at the state level. Would we need to go to the commissioners, kind of say, this is something we really want to advocate for, get their, you know, thumbs up, and then I'm seeing Tom nod his head.
Yeah, but we wouldn't necessarily have to go in person to like a work session. We could do this via email also.
Got it.
To just
isolate it. I have to say that I have definitely, I wouldn't say a dog in this fight, but I have, you know, I'm very interested in this because, you know, here we don't have a plan. K-12 has a great plan. I see what OSU is doing. And I see this kind of primary prevention public health theme of going upstream. And I'm personally impacted by it too, with, you know, students. And I'm seeing a big it's increasing, and a lot of crisis happening. So I would be very interested in assisting or playing a role or supporting this. So I'm just throwing that out there. I don't know what PHAB wants to do, but I see Commissioner Chang. I'm gonna stop talking and let you chime in here.
Yeah, I mean, to go to your question, Sarah, I think it would be good if there's a critical mass of the PHAB that's interested in advocating on this. I think it would be good. It would be good to let the Board of Commissioners know, hey, we'd like the board to advocate on this. And also we are happy to do some advocacy as a subgroup of the PHAB, independent. We don't need board support as long as you kind of give us the thumbs up to do some advocacy. And you can argue, we're trying to find dedicated funding for one of your programs at the county, and some key staff positions that play important roles. And I can't imagine board members saying, no, don't do that. I could imagine them saying, we have all these other legislative needs, so we're not going to prioritize this for the board itself. But if members of the PHAB were offering to advocate, I can't imagine the board saying no.
Thanks. Heather, I see your hands up.
Yeah, so primary prevention in our state is very poorly funded at the state level. And suicide is one piece of that, but primary prevention in general, I mean, as Carolyn alluded to, it's grants, it's piecemeal together, it's very siloed funding. We did, with a coalition of local health officials, did ask every health department recently, like, what would it take to be well funded to do primary prevention work? Suicide prevention being one of those, but there's a lot: accident, injury, overdose prevention work, tobacco prevention. And so we put that together and sent it to CLO. And I don't know, Commissioner Chang, if there's talk at the legislative level around, it's sounding like there's some discussions around kind of how do we better fund primary prevention. So I just want to throw that out there, that the more we can get out of this silo funding would be so beneficial. So we can kind of have room, because as you mentioned, Rob, there's so much overlap in all of this work. So I think we just need to I can keep pressing CLO on this and find out what's going on in the short session around this, and Tom can as well, and Commissioner Chang. And there's a lot of work right now and talk being done around at the state level around the settlement dollars coming in for the opioid settlement, and at the state level, really trying to push that state level team and to look at what's going to prevention, because at this point, not a lot of it is at the state level. I will say our BOCC did give us some of that funding, which was really helpful. So we were able to hire an overdose prevention coordinator. A lot of counties didn't do that. So I actually really appreciate that we were able to get that done here locally, but we need it better funded at the state level.
Well, and the reason I brought that up is because this is all of a piece, right? And so what's happened, the state gets a tranche of money or has a budget surplus, and then the Oregon Health Authority, poorly named, decides to fund people that are in the middle of behavioral health, I'm going to pretend. But then there's no funding to actually have facilities or training for, say, inpatient or adolescent psychiatric units, and that's directly related to suicide prevention. And so you fund little bits and pieces, and these funders come out with, oh, you have to apply for a grant. Like, that doesn't work very well unless it's coordinated, right? So we've lobbied our brains out at the federal level for funding for a this is personally my thing, at the psychiatric level, and we've been talking as a group, like, this is a state issue, and the state has funded various levels of care for behavioral health, but there's nothing available to actually increase the access to that 5% of people that need inpatient treatment, serious psychiatric care. And, you know, this happens throughout every effort that we try and make, because it's all interrelated, right?
Mhm.
From primary
think-
prevention to tertiary care. It's
Yeah.
like,
And it's challenging. Those who work in prevention know this better than I do. It's challenging because when you get these short-term grants, prevention takes time.
yes,
And it's sometimes harder to explain at that legislative level of the importance of the prevention work and that it takes time. And we have challenges even at the local level sometimes trying to explain that. And so I think having these 1, 2, 3-year grants, it's not sustainable funding, and that's what prevention really needs, is sustainable funding.
well, and that's what most things need. If you really want to fix a problem, then you need to have a plan for the next 10 to 20 years and sustainable funding, not just these little tranches.
One data point from the state of Oregon that is hopeful in relation to this conversation is that because of the legislation that we do have, Oregon Health Authority follows the systems that are mandated to do suicide prevention related to our legislation. And in their most recent report on some outcomes associated to our preventative work for 24 and under, because again, postvention is only, our legislation is only for 24 and under. While our program responds to the whole lifespan, we're not mandated to respond for 25 and up. So their report, most recent report, was that in 2021, they saw a 26% decrease in youth suicides of ages 24 and under. So one could surmise that the initiatives that are connected to our legislation and you know, these coordinated efforts that you all are talking about and how prevention takes some time. I mean, that's actually a really short period of time, because really that legislation went into effect, you know, started going through the legislative process in 2015, but really didn't go into effect until 2020. So, you know, seeing some really positive results very early on is good. The only thing to highlight, though, is that data really showed that it was having an impact on white youth. And there are a lot of minority youth groups of the age bracket that this legislation is connected to that is not seeing a change. And so we definitely have more efforts to be done there.
And that's great. You know, correlation, like for a scientist like me, sort of, correlation is not causation, but it's often a good argument for funding. So are there, I guess they're not interested in people like me who are over 60 who have a phenomenally high rate of suicide?
It's a constant conversation as to around the age bracket, you know.
Yeah. Any other comments or?
I wonder, and Carmen, I don't mean to put you on the spot, but I'm just thinking about, as we move through the regional health assessment and into the regional health improvement planning and kind of that work, I think that's another important avenue for this group to understand at the local level, as far as resources and funding and what issues are affecting our community, maybe at a higher level than other communities, and what's going to come out within the regional health improvement plan and where that funding goes, right? When, I mean, those are grants, but again, looking at all the different levers for how we can tackle this. So more to come on that. But I don't know if Carmen, you wanted to say anything on that.
Oh, you know, once you open the Pandora's box, right? There's, you know, the whole intent of the regional health improvement plan was to actually create those long-term investments and impacts. That's why we have a 5-year cycle. And for those work groups to have deep investments. I mean, that's what we're doing with the residency program, right? And that said, we do know that we have now parameters, just like all funding has parameters on how we spend it, and what that looks like. We're limited now. We can't do anything on workforce development. I think many of you know about what's happening in that space. I do know that there are other programs that are coming up with the aging population, if that's a good way to say it, Dr. Ross. So that we are
The elderly, the
yes,
infirm.
yes, and I'm definitely in that space now. So, but really addressing within the, because our lane is Medicaid, but technically Central Oregon Health Council is supposed to take a look at the entire region's health. That's what the regional health assessment is for. So, I do think there's opportunity there. I do think that there's better ways of how to weave funding together. I think the region is getting better at that. I know that I've been working with some local partners in the housing space in terms of, okay, hey, there's this bucket of money that's coming here, but you can only spend it on sticks and bricks. And how can we wrap services around with some of the funding that we have? So just getting really creative in that work, I think is going to be important. But, it's a lot of the same people on the table too. So
Yeah.
sounds like messaging is starting to happen. And, working closely with public health, we're meeting not just within Deschutes County, but across the region, because we know how funding, disparities are happening in Crook and Jefferson too. So, I think seeing all of that, I mean, gosh, we might even maybe we should have a funding summit, so, yeah.
Well, and the Central Oregon Health Council also provided some grant funding to the Forward Project, which is a suicide prevention project. It's aimed at lowering K through 12 suicide deaths and attempts, and particularly in our more higher risk student population. And so it directly attaches to some of the work that the ADDIES Act legislation requires. And that project could easily be kind of a way to look at what does it cost to do the mandate work.
Right. And Jim Bowen is actually going to do a presentation on that. The thing is with programs that we try is it takes a minute, right, to build up a program, and then it's successful. And then how do you continue to fund it? I think that's the puzzle we're consistently trying to address. And if you're saving money on the health system side here and spending here, how do we move that? I know Heather and I are constantly having those conversations. When you create savings here in the health system because you've invested in this program, how can you now put those expenses in that space instead of treating post-vention? And actually that project, Caroline, that was a behavioral health shared savings project about 3 or 4 years ago that we invested in COSPA. And it took about a year to put that program together, but it is so amazing and successful from the reporting that I've seen. So
yeah, that's great, and we all appreciate Central Oregon Health Council's support for our various projects, right? But in reality, it's the sustainability that I always worry about. And when you're an accountant, or well, a lot of people think in the short term, which to me is like 2 to 3 years, but often it takes a lot longer. And also, if you can't show the results in the next spreadsheet, it's like there's no accounting for the amazing savings down the line in terms of lives or money or however you want to count that. So we have no good way of really measuring, what was the outcome 10 years afterwards, which is really important, I think. But
yeah, I agree with you, Dr. Ross. Even community assets, what community assets have we built because of this process? It's hard to put that in numbers, right? But someone that feels like they belong in a community, I mean, all of those safety kind of metrics. So yeah, there's some good work that's happening out there. I'd love to bring that to this team to share at some point.
Absolutely. How about next month? Just kidding.
Sure, they're not my projects, they're community projects. Okay.
Any other thoughts, or this has been a great discussion? I know we haven't technically followed our.
Well, I think we just
having a strategic
naturally
dialogue.
transitioned into our dialogue is what it felt like happened, so. I guess some of the takeaways here, they had some asks for us, for any advocacy. But also to keep our eyes out during the legislative session coming up, and that's something I can do. I can, put some feelers out there, see if there is anything going on, or also find out, who might be someone to approach that the committee, a legislator that PHAB could possibly reach out to. So I'll do some digging around that part.
All right. Go ahead, Tom.
Oh, just any other thoughts from any of the other members of any actions maybe that you feel you could take at this time? Of course, with the county budget processes coming out, we'll definitely include PHAB in that if we need some advocacy on certain areas.
I was just going to mention, I'm going to reach out to Bethany and Carolyn directly, because we're hosting a big provider training event next week, and I'd love to include any materials or handouts if you have them. But thank you so much for your work, and thank you for presenting. It's really great to hear.
Yeah, for sure. And just keeping track of the time, it is 1:31, so I don't want to keep people, I'm sure most of us have other things that we have to attend, so.
Except for Melissa, Rob, Colleen, and I need to stay on.